Now, Kenya's Health Minister, Mutahi Kagwe, says Kenyans who are not fully vaccinated against COVID-19 will be barred from bars, restaurants and public transport from the 21st of December. This decision gives more 20 million adults in Kenya just a month to get vaccinated. The Health Ministry says the measure is aimed at increasing the rate of vaccinations ahead of the festive season. Less than 10% of Kenya's population is currently vaccinated. They're talking about 6.4 million people out of the country's 50 million population. The government hopes to vaccinate 10 million people by the end of December. Now, let's talk this through by speaking with a medical doctor, Adetoro Adedoyin, who is joining me from the United States. Thank you so much for joining us on World Now. Despite the vaccination campaign drive, less than 10% of Kenya's population is currently vaccinated. That's about 6.4 million people. What do you think remains responsible for vaccine hesitancy?
Well, thanks for having me. It's an opportunity. It's a great opportunity to be here to talk about COVID vaccines. Yeah, as you rightly said, less than 10% has been vaccinated in Kenya. One of the reasons probably is due to supply. As you are well aware, there has been a lot of critics and criticism of the West not being able to supply enough vaccines to the developing countries. And so I would say one of the reasons you're probably seeing less amount of vaccination rates in developing countries probably due to supply at this point. And also number two will be education, right? Many governments need to really educate their population on the benefits of vaccination and on the risks. No one really all over the world is doing enough to educate their population, and that's why you see the disparity in the amount of people that need to be vaccinated and to reach herd immunity.
Well, it does appear that a whole lot of people across the world are letting down their guards in observing non-pharmaceutical measures. Now, countries like Germany is now considering full lockdown. How do we find ourselves back at where we thought we had left?
Well, I mean, the reason why countries like Germany are considering full lockdown is because they're seeing the impact of the COVID-19. They're seeing, an increase in the death rates, right? When you as the holidays are coming on, and I'm sure you're going to be talking about that, people tend to congregate more, and because of that, you're going to naturally see more people will be infected, more people will infect others, and if they don't mitigate that early on, then the death rate will rise, and then we'll see another surge, just like we did last year when we sat down and spoke in 2020. We saw that surge over the holiday, the festive period. There is bound to be another surge over the festive period if governments don't take proactive measures.
Well, do you feel it's kind of sacrosanct that people be placed under compulsion to get vaccinated after all?
Yes, there has to be a balance, obviously, right? People still have to be able to enjoy the festive period, enjoy the holidays, but not let down their guard. Because what happens is when we do not follow the instructions of our different health organizations and health bodies that have been established in different countries, because their job is to make sure they protect the population, right? So they're looking at the data, they're looking at the stats, right? The regular layman is not looking at the stats of the infection rates, the death rates. So because they're looking at those statistics, their job is to make sure they do everything within their power to prevent the surge, which might mean infringing on some of the comforts that we have, that we enjoy during the holiday season.
Well, it just like, talk about Africa now. Looks like Africa is copying other countries in applying these drastic measures such that it appears we are creating much tension on the people because the death rates recorded from, say, Nigeria is not even up to 3,000 compared to the Western world. So why does it look like we are putting ourselves under much tension in this vaccination drive?
Yeah, great question. Great question. They always say it's always better to learn from experience, right? You want to learn from people who have seen the higher death rates. And because Nigeria is not experiencing similar death rates that you're seeing in Western countries, doesn't mean someone should let down the guard and wait to get those rates, right? It's always, like I said earlier, it's always better to be proactive, to make sure all the mitigating measures have been followed, right? Because, like they say, prevention is always better than cure, right? So anyone that has fallen sick will always appreciate the fact that if they could have prevented the sickness, it's always a better option. So yeah, every measure that has to be taken, such as wearing masks when you're in close proximity to other family members, um, such as if you're in an indoor environment, there's a lot of you open the windows, allow good airflow, right? Now, because of the festive season, you've seen a lot of you know kids, students coming back from school, right, from dormitories. They're coming back to meet their parents, meet with elderly ones, right, who might not necessarily have as strong an immunity as the younger ones, and that sets up a myriad of basically a chain reaction where you see infections rise. So definitely, people just definitely need to take precautions.
How people go ahead in taking these precautions, because some even are rights activists have said it amounts to it's rights issues when people are not allowed to enter places, public places, banning them from entering public places because they've not been vaccinated. But then this continues to be a global conversation, and we'll see how we we live with this and sum up this at the end of the day. Thank you so much for speaking with us, Medical Director Adetoro Adedoyin, speaking with us from the United States. Thank you.
You're welcome.